Welcome back, everybody, to the Health and Social Services Subcommittee hearing of the House Appropriations Committee. Today is January 29th. It's 1 p.m. Super excited to have everyone back here in this room. We are very privileged to have the opportunity to hear from Department of Legislative Services first on the Maryland Institute for Emergency Medical Services Systems. Naomi Kimura is our analyst. Welcome, and we will go ahead and kick off with you.
Thank you, Chair Shetty. My name is Naomi Kimura. I'm a budget analyst with the Department of Legislative Services, and I'll be presenting the fiscal 26 budget for MIMS. So MIMS oversees and coordinates all components of the statewide emergency medical services system. The fiscal 26 budget for MIMS includes $25.8 million for MIMS, which is $3 million more than the fiscal 25 appropriation. Most of MIMS's funding is originating from special funds from the Maryland Emergency Medical System Operations Fund. The fiscal 26 budget bill also includes a proposed deficiency for fiscal 25 of $280,000 in the MIMS budget for the renovation of the parole tower. There's also $1 million budgeted in the Board of Public Works for this project. The $280,000 is just the difference between the estimated cost and the actual project cost. On page 3, Exhibit 1 shows the breakout of the MIMS budget in fiscal 26. As you can see from the pie chart, a majority of MIMS's funding is allocated toward personnel costs. There's also a little over $3 million in the budget for telecommunications expenses and about $2.3 million for building and equipment maintenance costs, which includes the cost to upkeep communications towers around the entire state. Pages 4 and 5 summarize the major changes between the fiscal 25 and fiscal 26 budget. Again, the budget is increasing by about $3 million, and that's really driven by an increase in costs related to personnel for salary increases and fringe benefits. I'll also point out there's a new pilot program which is federally funded by the CDC as a part of the National Health Safety Network. It's a connectivity initiative pilot which aims to understand hospital bed capacity around the nation. MIMS is taking on that project in fiscal 26, and there's $390,000 in the budget for that. On page 6, we've summarized some of the personnel data for fiscal 26. The allowance includes 2 new positions in MIMS, one for an ambulance inspector, which is actually a contractual position that's already filled, and the other is for a program manager to oversee the AED and naloxone program which MIMS is required to implement, which requires MIMS to co-locate 2 doses of naloxone with AED devices in public buildings. The main issue in this analysis is related to emergency department wait times. Maryland has some of the highest emergency department wait times in the country. The exhibit on page 8 compares the median wait times in each state and in Washington, D.C. and Puerto Rico in calendar 2023. The average in the of all states in the U.S. is 163 minutes, and Maryland's average is above that at 250 minutes. MIMS is a part of several different commissions and work groups and efforts to understand this problem and come up with solutions for it. One of those is the General Assembly Hospital Throughput Work Group, which concluded in January 2024. They published their final report in March of 2024 with 17 different policy recommendations. One of them, which directly involves MIMS's input, is to enhance data collection from multiple providers in order to reduce inefficiency. I'll also note the Critical Care Coordination Center, which is discussed on the bottom part of this page. MIMS established the C4 in December of 2020 to alleviate strain on the healthcare system brought on by the COVID-19 pandemic, and has continued to operate the C4 in subsequent years. Essentially, this is a way to connect patients to the resources that they need, including transferring patients to hospitals outside of the state when Maryland hospitals have reached capacity. The fiscal 23 and 24 budgets included funding for this purpose, but MIMS has canceled funding in each of those years. They placed the C4 in hibernation in June of 2024 due to lack of available funding because the grant funding that they were using expired, but they have indicated that they plan to reopen or restart rather operations in fiscal 2026 and that they are working to identify other funding sources to make that happen. The fiscal 26 allowance does not include any funding for the C4. So DLS is asking MIMS to specify the amount of the fiscal 2024 appropriation that was canceled for the C4 and also how it plans to source funding to continue the C4 in fiscal 26. Finally, DLS recommends concurring with the governor's allowance for MIMS, and that concludes my presentation.
Thank you, Ms. Komuro. Appreciate the thorough analysis and review. Do any members of the subcommittee have any questions? Great. Thank you so much. All right, we'll bring up Dr. Delbridge, Executive Director of MIMS, next. And if you have a team, you're welcome to bring them. If you want to reference them, they can wave. That sounds good. And when you're ready, you may begin. Thank you so much for joining us.
Thank you, Madam Chair. It's great to see you again, and thank you, members of the committee, for this opportunity. As Naomi pointed out, MEMS, the Maryland Institute for Emergency Medical Services System, is an independent state agency that coordinates all aspects of the statewide emergency medical services system. We do that through promulgating statewide clinical protocols that are used by the EMS clinicians in the field throughout the state. By licensing and certifying EMS clinicians, nearly 20,000 of them, by operating a statewide communication system and designating trauma and specialty centers, as well as licensing and regulating commercial ambulance services that include about 496 ambulances across the state that last year completed over 240,000 patient transports. About 578,000 people were conveyed by the EMS system last year from someplace in the field to Maryland hospital emergency departments. We appreciate the hard work of Naomi Komuro and her comprehensive analysis, and also would like to acknowledge Christina Jorge-Tunyan, our DBM budget analyst. We closely monitor, as a way of assessing hospital capacity, the EMS to emergency department transfer time, or the elapsed time it takes for EMS personnel to transfer responsibility of care for patients who they deliver to hospital emergency departments. We do that by providing weekly transfer time reports to hospital and emergency department leadership throughout the state so they can use that information to improve their process and monitor progress and prioritize arriving EMS patients to their facilities. We also provide monthly data to the Health Services Cost Review Commission as part of its challenge to engage hospitals in its Emergency Department Dramatic Improvement Effort, or EDI, which calls on hospitals to do better at improving efficiency throughout their emergency departments. The data indicate that the transfer of care intervals have improved modestly over the past year. Approximately 40% of Maryland's emergency departments meet the 35-minute target more than 90% of the time, which we use to indicate a highly reliable organization. We are responsible for designating trauma and specialty centers. In Maryland, that includes 10 trauma centers, 24 cardiac interventional centers, 2 burn centers, 39 stroke centers, and 15 perinatal centers. In the past year, we've conducted 31 hospital re-verifications that include cardiac interventional centers, stroke centers, and freestanding emergency departments. As Naomi pointed out, we are responsible for the public access automated external defibrillator program in the state and have used the last year to renew our AED registry, actually stand up a new version of that, which became functional in December, that will make it easier to track AEDs in restaurants and grocery stores, which was a legislative priority last year, and also to be in the process of co-locating naloxone with AEDs. Naomi discussed the Critical Care Coordination Center, stood up in December of 2020. Over the course of its 43 months of operation, we fielded 7,000 calls. 70,000 would be a lot. 7,000 calls from hospital clinicians trying to locate critical care resources for their patients. Most notably, in 30% of the cases, the assistance provided by the C4 physicians, including intensivists and pediatricians, and the coordinators obviated the need for patient transfer at all, saving those resources for other patients who were in need. The grant funding for the C4 expired in June of 2024, at which time we put the C4 into a state of hibernation. We are looking for grant opportunities to reanimate it, hoping to do it in July of 2026, or 2025, I'm sorry. Fiscal year 2026. But we haven't yet located grant funding, and so we remain in a state of hibernation until that time. And I think I'll stop there. I'm happy to try to answer any questions. And if you ask really hard ones, my team will help me.
Thank you, Dr. Delbridge, for being here and for the important work of MIMS that you guys do every day. I'll turn it to the subcommittee to see if any members have questions. Delegate Heinbach.
Thank you, Madam Chair. First of all, thanks for being here, and thanks for the critically important mission that your organization performs.
Thank you.
Not a lot of organizations are involved in life or death situations like you all are at times, so thank you to the organization. I noticed on page 2 of the DLA analysis that it says that $114,893 in federal funds were not used, were returned. I think they were originally appropriated for the Maryland National Capital Region Emergency Response System. I'm just curious about why those were returned.
So the ERS is a function of Homeland Security in the Urban Area Security Initiative. Grant funding comes to the ERS to support emergency preparedness activities in Montgomery and Prince George's County specifically. And it is incumbent upon those jurisdictions to develop projects that are eligible for grant funding. And so if money was returned from the ERS to the grant initiative, it is because of a lack of initiatives in the grant period, which is complicated for me to keep track of in the sense that the grant comes, the funding is for a fiscal year out. It sort of doesn't align well with the state's fiscal year. And so I'd have to look more carefully at that specific funding stream to know exactly why that was returned, but that's basically the concept.
Thank you.
Thank you, Delegate. Thank you, Dr. Delbridge. Vice Chair Jones.
Thank you so much. Thank you so much for being here today, for all of the amazing work that you do. I just wanted to drill down on a few questions. I'm going to throw out some page numbers and exhibits for you so to make it easier. So we're going to page 5 near the bottom of exhibit 2. 259,000 is allocated for travel and conferences. Appendix 2 table on page 14, line 4 indicates that this is a 35% increase from last year. I was just hoping maybe you could expand about how these funds would be used and how many conferences are attended and the value add that these would provide to your team.
That specifically relates to the emergency response system in Prince George's County and Montgomery County, and it's paying for not travel for MEMS personnel. It's paying for travel and conference fees for the constituents in Montgomery and Prince George's County. So it could be, I'm not familiar with the exact programs that was referring to, and I'm happy to get that information. Okay. But it's travel for police officers, firefighters, emergency management people to go to conferences that they have deemed necessary for their own preparedness in those 2 jurisdictions.
Great, thank you so much. And then let's look at Appendix 2, line 8. Could you drill down a little bit more on what all is inclusive of the 54% increase in the contractual services?
Can I get back to you?
Sure.
With specific data on that?
Yes.
I'm happy to. It contains some IT support and some other things that we pay for routinely.
Okay.
And we've experienced incredible inflation over the past fiscal year that have related to that, and I'll get you the breakdown of exactly what that includes.
Well, thank you so very much. Thank you, Chairwoman.
Thank you, Madam Vice Chair. Thank you, Dr. Delbridge. Delegate Ruff.
Thank you, Madam Chair.
First question in our subcommittee as our newest member. Lots of pressure.
You could have saved it for the next guy.
Well, you can partially blame my my legislative intern, who is Rashana Brinkley, who's in the audience with me, who helped prepare me for this hearing. So Dr. Delbridge, thank you very much. I wanted to focus just a little bit on the C4, and I think you would agree that, you know, getting funding for C4 would obviously help us with our emergency wait times. Is that accurate?
Well, it's a complicated interplay. So the C4 was really the result of an awareness that hospitals had critical care patients when they lacked critical care capacity and weren't necessarily aware of what resources were available in hospitals that weren't generally in their referral stream. And so to the extent that it helps offload clinical staff from having to do logistical feats in terms of identifying those places and arranging for patients to be transported, it does help with the efficiency of the emergency department that the critical care patient is in. More so, it helped in 30% of the cases obviate the need for patients to be transferred at all, which was hugely beneficial to the healthcare system.
Got it. So I know DLS has already asked you guys to expand on those grants that you're looking at, and I know you said you're working on looking at grant opportunities. Is it possible that you can give us any, potential sources that you're targeting, or at least figuring out what assistance anyone can provide you all with working to get the C4 back up and funded?
So we've specifically looked at grant funding from the CDC, who was the benefactor, or the benefactor for the first go-round, and those grant monies were specifically related to COVID and funneled through the Maryland Department of Health. But we looked there. Homeland Security is another option. Those are the places that we've looked most intensely.
Thank you.
Thank you, Delegate. Thank you, Dr. Delbridge. Delegate Acevedo.
Thank you, Madam Chair. A quick question, and it's just a follow-up to a question, information that was requested by our Vice Chair around the contracting. You had mentioned IT, that you all contract for some IT issues, et cetera, and that you provide more information. Do you recall that?
Yes.
Or is that, okay, good. If you could let us know when you're responding to us, because there is the Maryland Department of Information Technology that does support state agencies and coordinating offices. So if you all are contracting with outside groups for IT solutions, understandably so, whether your office or your agency reached out to Department of Information Tech, if that's something they can do as opposed to just outsourcing it to someone else.
No, we work closely with Do It.
Okay.
So MEMS has an internal IT department that is in close cooperation with Do It. The IT support that I spoke of that we contract out for has to do with hardware, like emergency hardware support inside our facility.
And that's not support that DOIT provides or
Do It supplies some support, and this is in addition to that.
Gotcha. Okay. Thank you. Thank you, Madam.
And again, I'm happy to provide the details of all that.
That would be great. Thank you. Great question. Any further questions from the subcommittee? Okay. Thank you so much.
Thanks.
We appreciate it. We look forward to the follow-up. Thank you.
Thank you.
All right, we will now move to the Maryland Commission on Civil Rights budget, and we'll start with Natalie Andrade, who is our DLS analyst who is prepared for this. So thank you so much for being here, and thank you for your analysis. We look forward to hearing you when you are ready.
Thank you, Madam Chair. Good afternoon. I am Natalie Andrade with the Department of Legislative Services, here to present the fiscal 26 allowance for the Maryland Commission on Civil Rights. On page 1 of the analysis, you can see that the fiscal 26 budget increases by $970,000 or 16.1%, bringing the total to $7 million. On page 2, the fiscal 26 budget includes a proposed efficiency appropriation totaling $689,000 for fiscal 25. These funds address shortfalls in personnel expenditures caused by underestimated salary costs in prior years. After accounting for new positions, budgeted personnel costs decreased in fiscal 26 compared to fiscal 25 working appropriation. While the Commission has expressed concern about this decrease, the agency believes that the fiscal 26 budget will adequately meet the staffing needs, reflecting appropriate funding levels for both existing and new positions. On page 3, Exhibit 1 provides a breakdown of the fiscal 26 allowance. Personnel expenses account for 89% of the total budget. The remaining funds are allocated to technology, rent, and events like the gala, which represent 1% of the total. Page 4, Exhibit 2, outlines the line item changes to the budget. The $970,000 increase is driven primarily by $1.2 million in salary and fringe benefits for 11 new positions and 1 contractual conversion. This increase is partially offset by a reduction in salary and fringe benefits for existing staff, reflecting adjustments in prior year deficiencies. On page 5, in the personnel section, you will find that the Commission's fiscal 26 allowance includes 11 new positions and 1 contractual conversion to address long-standing staffing shortages. Turning to page 6, the key observations section begins with a discussion of recent patterns in civil rights inquiries and complaints. Exhibit 3 shows that in fiscal 24, inquiries rose to 2,297, while complaints increased significantly to 966 cases. The Commission attributes this growth to enhanced education and outreach efforts. On page 8, Exhibit 4 focuses on a case backlog. In fiscal 24, employment cases accounted for 314 unassigned cases, or 32% of the total complaints received for processing, while 2% were public accommodation cases. Exhibit 5 on page 9 highlights the status of active and pending cases in fiscal 24, with employment cases comprising the majority at 363, followed by housing at 212, and public accommodation at 25. Of these, 392 cases had been open for over a year, including 319 employment cases, 68 housing cases, and 5 public accommodation cases. Exhibit 6 on page 10 illustrates ongoing challenges in meeting the case processing benchmarks. Housing cases in fiscal 24 averaged 331 days to process, far exceeding the 100-day benchmark. Employment cases averaged 350 days, and public accommodation cases took an average of 448 days. Also on pages 10 to 12, an audit conducted by the Office of Legislative Audits in October 24 identified 5 key findings related to delays in case processing due to staffing shortages, insufficient documentation for vendor payments, lapses in oversight of corporate purchasing cards, inadequate controls over gala revenue and expenses, and insufficient cash receipt controls. The Commission has acknowledged these issues and outlined corrective actions, such as improving documentation, enhancing oversight, and strengthening financial controls. Finally, on page 13 of the analysis, the Department of Legislative Services recommends adopting committee narrative, requesting that the Commission submit a report evaluating the impact of adding 11 new positions and 1 contractual conversion on case assignment and backlog management. And with that, I conclude my presentation, and I'm happy to answer any questions that you may have.
Thank you for the analysis. Any members of the committee have questions for our analyst? No. Okay, thank you so much. We will now bring up Mr. Cleveland Horton II, our Acting Executive Director of the Maryland Commission on Civil Rights. You may bring whatever team members you would wish to the table, and just please introduce yourselves, and you can begin when you are ready. Are there enough seats for everybody, enough mics? Okay, great. Thank you so much.
Good afternoon, Madam Chair, members of the committee. My name is Cleveland Horton. I do serve as of September the 6th of 2024, I do serve as the Executive Director for the Maryland Commission on Civil Rights. So it is our privilege and honor to be here before all of you this afternoon. We also want to thank our analysis for the thorough and complete assessment of our agency. So I think it's like Natalie. Makes it a little easier for us. So we do appreciate their analysis of our agency. So I know that you all have in front of you or submitted previously our written testimony as well as a copy of our most recent annual report, along with support letters from the Equal Rights Center and the Legislative Black Caucus in reference to the support for the governor's allowance for our budget. So I won't regurgitate a lot of that information. What I would like to do is just first, my apologies, introduce the wonderful team that I have with me today. Starting to my left, we do have our 7-day-old now, week? Our week-old Deputy Director, Yolanda Sonier. To my immediate right, we have our Assistant Director, Nicolette Young. And to my farthest to my right, we have our long-standing General Counsel, Ms. Glendora Hughes, which we call AKA our muscle. And we are all privileged to be here before you all today. So just from a personal anecdote standpoint, and I do appreciate the indulgence, on January the 9th, 2025, on Daywalt Avenue, there was the first homicide in Baltimore City. In front of my childhood home, in front of the home that my mother still resides in. Upon me hearing of this information, I contacted my mother in hopes that she was at work that day. Unfortunately, because of the hybrid environment, my mother was home that day. In fact, my mother did witness the horrific murder of a young man in front of her home. Upon witnessing the event, my mother went outside. And when I learned of the encounter, you know, as children, sometimes as we get older, we feel like we can counsel our parents on what are the right things to do, right? And I attempted to do that, I believe valiantly, in reference to allowing law enforcement to do what they need to do and make sure that you're not in the middle of a crime scene because you don't know if it's over, retaliation could happen, a number of different things. The first thing my mother said to me was, well, I do believe I'm your parent, right? But then she proceeded to tell me that she did not want this young man to die alone, right? She did not know him. She had never seen him. The only thing that she knew was that this young man was dying directly in front of her home, and she did not want him to die alone. When I had the opportunity to visit my mother later that evening, upon grabbing her, just hugging her again, trying to counsel her again, right? She informed me at that point in time that our communities, as individuals, we seem to lost our sense of humanity, and that we need to figure out how do we continue to protect humanity. And at that moment, she looked up at me because my mother's just a little over 5 feet. And as you all could tell, I'm standing somewhere around 6'7", depending upon what shoes I have on. And she looked at me and she said, but isn't that your job, to protect humanity, right? The work that you all do at the Maryland Commission on Civil Rights. So I offer to you all today that, yes, that is our job, but I think that's all of our jobs in terms of how we protect humanity. At the Maryland Commission on Civil Rights, our job is to protect it from a sense of defending and protecting civil rights. And I think we do a darn good job of that. Historically, our agency has been at a point where we've had a little over 100 employees. We find ourselves in a situation where we have about 39 employees to cover the entire state. So when we talk about protecting humanity in a way that allows us to protect and defend civil rights in this climate, I think we all, being reasonable, should recognize that 39 employees to cover the entire state is just unreasonable. I've been with this agency for 17 years. Some would say I'm a glutton for punishment. Some would say find something else to do, find a higher paying job. But I do it because I am surrounded by good leaders. I'm surrounded by folks who are passionate and committed to protecting the citizens of Maryland, to make sure that everybody's civil rights are protected. But just saying it is one thing, right? Putting the resources behind it is another. So being with the agency for 17 years, this is the first legislative session that any administration has poured resources into the Civil Rights Commission. The governor's allowance will allow us to bring about 15 pens into our agency. The allocation of those 15 pens will allow our Education Outreach Department, which is currently 3 people, to double in size to 6. So it will allow us to be able to bring in 3 additional education outreach personnel to be able to educate people on what their rights are throughout the entire state. Our agency is attempting to be not just reactive, but also be more proactive. We do believe that it's very important for us to be able to educate the public on what their rights are and what to do if they feel as though their rights are violated. And just having 3 people to cover the entire state, again, is a very tall task. It would also allow us to bring in 2 additional assistant general counsels. Right now, we have 2 acting attorneys to litigate all the cases that come through our agency, whether that's legal opinions, litigation, issuing guidance, and it's very difficult for them to do so with the caseload that we have, which results in the backlog of our cases to go through litigation, which results in the backlog of our cases from a legal opinion standpoint, which also delays the amount of trainings that we can do from a legal perspective based off of the resources that we have. So this governor's allowance will allow us to address that. It also provides about 9 positions in our intake and investigative units as well. So if you take a look at the analysis, and you'll see the data that indicates that we do have a significant backlog. As of today, we have about 490 cases in backlog status waiting to be assigned an investigator. With this governor's allowance and bringing on those additional pens, we will be able to fight through that backlog and be able to respond to complaints of discrimination in a much more timely fashion. From an internal standpoint, our benchmark is to be able to respond to complaints of discrimination and resolve them within about 180 days. Right now, we find ourselves at about 1.5 to 2 years from start to finish based off of the resources that we have. And we would say honestly and respectfully that that's just simply unreasonable. For an individual that has lost their job because of sexual harassment or because of any type of discriminatory action, having to wait 2 years to have that resolved is unacceptable. For an individual that's lost their housing, been evicted or denied housing as a result of a discriminatory motive, and that's not being able to respond to that for almost 2 years is also unacceptable. So again, with this governor's allowance, it does allow us as the Civil Rights Commission to be able to enforce our laws in a much more reasonable and timely fashion. So we recognize through the analysis that we mentioned the fiscal audit findings. Our agency has taken the appropriate action from a realigning of staffing and in the issuance of internal policies to address those findings, as you'll see in the assessment, which have been accepted and approved. Our last 2 or 3 fiscal audits were crystal clear, and we are confident that with the measures that we've taken, we will get back to that point. But from a leadership standpoint, we take full accountability for those findings, and we have addressed them aggressively, and we believe we have the appropriate remedies to ensure that those findings do not occur within the Maryland Commission on Civil Rights. So with that being said, we are here to answer any questions. We do ask for the concurrence of the governor's allowance to allow us to bring more resources into our agency so that we can ensure that we're living up to our mission to make sure that we're protecting and defending civil rights throughout the entire state.
Thank you so much, Mr. Horton and team, for joining us today. And thank you, Mr. Horton, for sharing that personal story about what has happened to your mother and your family. I can't imagine how traumatizing that must have been for her and for you to learn of it after the fact. Your mother sounds like good people. I think as like a mother myself, I think I would have trouble knowing that if anything ever happened to my son, that he were facing it alone. So thank you to your mom for doing that.
Thank you.
And even though I recognize that it was against your counsel otherwise. Another broader thank you to you and your entire team for the immense amount of work, important, critical work that you do for Marylanders, especially in this extremely toxic environment that we're facing right now with the change in federal administration. I am grateful to see the recognition in the governor's budget of the importance of your work and really appreciate the thorough analysis of our DLS analysts and your response. That said, I know we have some members with questions, and so we appreciate your availability to answer them, and I will start with Delegate Ruff.
I would just say that we want to ask all questions to our WECO Deputy Director. No, just like
In that case.
Thank you, Madam Chair. And is it Ms. Saunier?
Ms. Saunier, yeah.
I won't do that to you.
I appreciate you.
First, as a civil rights attorney, I have to say, keep on keeping on.
Thank you.
please stay the course and understand that we are here to support you. We understand how important it is that these cases get addressed. I get the same types of inquiries that you all get on a daily basis, and I understand how you all are in the circumstances you're in, and I think that all of us are here dedicated to making sure that we assist you all in figuring out how to get to a place that is more tenable, where you really can be completely on the path to protecting humanity. And so in that vein, I wanted to talk about the backlog and how you guys calculated the anticipated backlog. And I'm assuming that 800 complaint backlog prediction was without the pins. Is that correct?
Correct.
Can you kind of tell us how you guys calculated that? And then I'll have a follow-up.
Yeah, so basically taking a look at, we've taken a look at our current trajectory. Historically, we were probably about a year and a half ago, we were at about 676, somewhere close to 700. May have been about 2 or 3 years ago. And we were able to, with the addition of some contractual pins, work down that backlog, right? What we've begun to see just on a trajectory in the additional inquiries that we are now receiving in reference to the number of complaints that we're now receiving, that we anticipate that our number currently will balloon in addition to the number of transfers that we're getting from EOC. So typically we get about, at one point we were getting about 40 to 50 transfers from EOC per month. That number has now doubled. So now we're anywhere between 50 to 100 transfers from EOC monthly. We do anticipate, because of the change with the federal administration and the reduction of the federal EOC's ability to enforce discrimination complaints, that number is going to escalate. Typically what we saw during the first Republican federal administration was the dilution of the EEOC and a significant increase in the number of complaints that we were receiving from EEOC. So using that same methodology in reference to our trajectory is how we kind of came to, we anticipate that our backlog will get to about 800, if not more, rather quickly. Again, we're already at about 500. So we do anticipate easily, and I think we've received over the last 2 weeks, our phones are ringing off the hook, as I'm sure the phones for you all as elected officials are ringing off the hook as well, in reference to the number of inquiries has escalated tremendously.
Understood, and that 800 number obviously is not acceptable, and I know that you all don't want to see that, and I'm very glad for the allocations that you all have received as well. I'm wondering about the plan for the internal allocation of the funds as far as the pins are concerned, and I'd like to hear from you and the muscle, Attorney Hughes, about whether there is any thought that can be put around the mode of education so that potentially you could reallocate some of the funds that you're planning on adding to the education piece to add to the actual litigation and intake and assigning the cases to folks and getting the cases worked up. I'm wondering if that's a conversation that's happening and whether that's on the table or whether you guys are already set on hiring the 3 education officers.
Yeah, so I think for us, what we looked at is historically when we've been able to add a pin here or a pin there, typically it has been in our investigative units, right? In terms of adding pins to the number of intake officers or the number of investigators that we have. What we realized over time is that until we begin to aggressively apply additional resources to our proactive arm, which is our education and outreach arm, that we haven't been able to make a significant impact on training and educating the public on what their rights are, right? So if we continue to do that, then we'll always be chasing the number of complaints versus actually making an impact and educating the citizens of Maryland in reference to what their rights are. So even though our number of complaints continue to climb, if you ask most individuals throughout the state, what is employment discrimination rights or fair housing rights, most individuals don't know, right? And that is part of our responsibility to figure out how do we educate more people, how do we reach more people, how do we have a larger impact? So when we took a look at these additional pins and trying to figure out where and how do we allocate these pins, the conversation was around, okay, well, how many do we apply from an investigatory standpoint to address the backlog? How many do we address? How many do we assign to our legal department or education and outreach department? We did decide that it was critical for us to add more additional pins to our E&O side because we are getting requests for training all day, every day. And we have to turn the majority of them down because we can't be everywhere at the same time. And we currently only have 3 individuals, right? So those 3 pins, we do believe, are critical to the educational environment of educating folks on what their rights are. But we do believe in doing the math that we will be able to successfully get through the backlog with the 9 pins that we are allocating to our intake and investigative bodies. We will be able to do so, as well as giving us the opportunity from a litigation standpoint to be able to more timely litigate the cases, because right now we do have a number of cases in queue that we do want to issue probable cause for, but we can't because we don't have the legal resources to keep up with the timeframes that we're required to in order to move those cases forward. So we do want to make sure that we're getting the appropriate redress for individuals in a sufficient amount of time, which is why we've also applied a number of those pins to our legal department to be able to do that.
And there is a flip side to the education. It's not simply just to provide education to persons to know their rights, but it's also to do technical assistance and training for employers, landlords about what not to do and what the law requires them to comply with so that we don't get the complaints. Or if there is a judgment or a decision made, to be able to go in and do training of their staff, of their employees, so that there isn't any repetition of what happened that caused the discriminatory act in the first place. So part of the education and outreach is not only letting folks know what their rights are, but also educating the business community, the employers, the landlords, the property owners, what not to do, and so that there isn't a discriminatory act taken in the first place. And some of that is done also by the legal department because we are the purveyors of the statute and the law. So I do a lot with the Bar Association. I do a lot with assisting some civil rights organizations in doing legal updates. So part of it is a preventive action as well as doing the enforcement part.
Very good, thank you. I don't want to hog the mic, but I do think we should also think about some private-public partnerships, trying to expand the capacity of your office, and I would support that as well.
We appreciate that. I think we have, in terms of our education outreach campaign, truly trying to be very strategic and targeted around increasing our partnerships. So we are absolutely open to that. I think as well, when we think about us as a state agency, part of our charge is to also be a resource to those local civil and human rights agencies. Many of those do not have the enforcement capacity that we have, nor do they have the resources that we have to be able to respond to a number of complaints. Our charge is also to be able to provide them with additional resources and support and training to be able to do so, which again, we're unable to do right now because we're struggling from a resource standpoint as well. As you all will see, on our website, we do also hold the Maryland Association of Human Rights Agencies within the Maryland Commission on Civil Rights, and that is a conglomerate of all of the local civil rights agencies within our agency to kind of meet and talk about the issues and how we address them. So many, if not all of honestly, all of the local agencies are kind of looking to us for that additional resource and support because many of them are struggling as well to be able to address them. So we are hopeful that with this governor's allowance, at some level, we will be able to provide some level of resource and support to those local human rights agencies as well.
Thank you, Delegate. Delegate McCaskill.
Thank you, Madam Chair. I too echo Madam Chair's sentiment with your mom, and I thank her though for that as well.
Thank you.
Welcome to the team, Sonia. So I have probably a personal guilt because when folks have issues in reference to your agency, I send them on over to you. And in reading this report and your challenges that's where my guilt kind of come in. So yes, we do need to make sure that we're being resourceful to you. I'm grateful to know that you're there to help ensure equal opportunities. And my first question, if I can, Madam Chair, is around the climate we're in now. I know you all will continue to have that heavy lift, especially with the administration over in Washington, D.C. And so I was referencing more so to page 1, really around your partnership with work sharing with the U.S. Equal Employment Opportunity Commission and the U.S. Department of Housing and Urban Development. And I'm just wondering if at all you can address any threats or threatening your relationship with them due to the administration that we have, and you all being able to see your work through.
Thanks for that question, Delegate McCaskill. I think that's the million-dollar question for us right now, too. We are having ongoing conversations with our federal partners in reference to what are they hearing, what's the rumblings within the federal government in reference to that. We know that during the first Trump administration, that we did see a reduction in enforcement efforts by our federal partners, which then shifted the primary responsibility to those local and state agencies from an enforcement perspective. We do anticipate that there will be a significant challenge from a budgetary standpoint to the EEOC and to HUD. To what level? We really don't know, but we would anticipate by the actions in the last 7 days that there will be some significant reduction in their, enforcement ability and their fiscal ability to provide resources to those state and local agencies, which will have a direct impact on our agency. Taking a look at our budget from a federal funding standpoint, we're at about 25–30% federal funds, and we are kind of very, very nervous in reference to what that will look like for our budget if we do lose those federal funds. But one of the things that we've committed to as a leadership team, that regardless of what happens, we'll continue to serve the citizens of this great state, and we'll continue to do the work. We are trying to figure out other avenues to bring in additional revenue, based off of some of the parameters that we do have as a state agency. It has been difficult for us to get individuals who want to donate to the agency to donate to us because we're not a 501c3. So we are kind of exploring different options and opportunities for us to figure out what are those options for us to seek out additional revenue and what are those channels to be able to do so. Part of the concern with that is a lot of that money is tied up in federal grants. And as we all know, there's a question about the existence of federal grants moving forward. But we are actively pursuing other options to figure that piece out.
Wow, thank you. Madam Chair, if I could, just one other question. I just want to reference to page, and please forgive me, page 11. And one of the audit overview, I'll give you a second. In reference to the gala financial availability, it just had like 2 questions, and I'll just ask the one first. In looking at this gala, can you please share the purpose of the gala?
Sure, I sure can. Another great question. The purpose of the gala really is it gives us the opportunity. We consider it to be an education and outreach event. Where we have the opportunity to bring together a large group of individuals to highlight the great work that our agency has done in the area of civil rights. It also gives us the opportunity to highlight those other individuals who have, throughout the state, have been instrumental in the civil rights landscape of our state. It also gives us an opportunity to network and partner with our strategic partners and talk about initiatives, what we can do to be better collectively as we continue down this journey to defend and protect civil rights together. So really the goal of the gala is to bring folks together to talk about civil rights, to celebrate civil rights, and to identify partners moving forward with a number of different initiatives. As you'll notice in some of the spending authority, so we don't typically, when you look at our special funds, and you'll see that I think it's allocated $90,000 towards the gala, that isn't the amount of money that we're spending out of our budget for the gala. We don't have, so anytime we spend money as a state agency outside of our normal budget, we have to request spending authority to do that. Our gala is fully funded by federal funds and the sponsorship funds that we get. So we get about $30,000 from, as you'll notice on page 11 on number 4, we get about $30,000 from HUD for our gala. We get typically another $30,000 or $35,000 from other major sponsorships. The rest of that is made up through ticket sales and individual sponsorships for the gala. So everything that we have up to this point for the gala, everything that we received for the gala, we put back into the gala. We had a meeting with the ethics department back in April of 2024 to really talk about how can we better utilize this gala as, again, a fundraising mechanism for our agency. We did receive the green light from the ethics department that we can utilize the gala as a fundraising avenue for our commission. So moving forward, we will do that. So typically it's been a biennial gala. We are moving that to an annual gala to allow us to use that as a fundraising mechanism to bring additional revenue now back into the agency so we can use that for some of our education and outreach efforts and some of our programmatic activities as it pertains to civil rights.
Perfect. Okay, great. Thank you, because my other questions were exactly just that, like, do you get your revenue, your funding from community partners, private partners, and then, okay, well, you answered exactly what I needed. Thank you, I appreciate it. Thank you, Madam Chair.
Thank you.
Thank you, Delegate. Thank you so much. And okay, I have some questions I wanted to get in if possible. So I have a little bit of confusion, sir, over the exact number of pins that you're requesting. Earlier in your testimony here, you talked about 15 pins. I think I saw in your response that you referenced 11 or 12 pins, and that. So I'm just curious the exact number and breakdown, please, of the positions that you're requesting.
Okay. So I am going to, because I think she's probably trying to kick me under the table. So I'm going to allow our assistant director to give you that breakdown.
Thank you so much.
Thank you. So so in this allowance, it includes 11 permanent positions.
Okay.
And then we had 1 contractual conversion, so that brought us up to 12 permanent positions. And then we also have funding for 3 contractual positions that were not funded as part of 25. So that's where the 15 comes from.
Okay. Okay, cool. So the 3 additional were the contractual. Okay.
Yes.
And then, thank you. That's super helpful. And then, Mr. Horton, earlier you gave a breakdown and said 3 education and outreach personnel. I think the DLS analysis says it's 5. Which one is correct?
What page are you referring to, if you don't mind?
I don't recall.
Okay.
Page what? Page 5?
So I think if you're looking at page 5.
Oh, nope, I see 3.
Yep.
I'm sorry, 3 education outreach, 5 civil rights officers, 1 converted investigator, 2 assistant general counsel. That's the correct breakdown?
Yep.
Okay, great. That's super helpful, thank you. And then so in the breakdown, you have a distinction, and maybe this is my read, but you have 5 civil rights officers and 1 investigator. Yes. So, but in your testimony, you talked about the civil rights officers being investigators as well. So in terms of their function, they are the same?
They are the same, yes, ma'am.
Okay, thank you. And then would you be able to get back to us with the breakdown, please, of the allocation for salary? I'm assuming the fringe benefits are somewhat the same, given that they're state employees, but for each of these 15 new pins, if you could please send us the breakdown.
We sure can.
Thank you. That will be really helpful. And then so I know in your testimony and in the answers that you provided to Delegate Ruff, you provided a lot of great information about the purpose of the education and outreach officers, and them being both a bit of like a prevention as well as like defense and offense for the important work that you do. And so I'm curious if, like how you came to the determination of this being the best allocation of 15 new pins for the extreme mission critical need of reducing the case backlog. Like how did you determine that this is the allotment needed?
So we took a look at the number of cases produced by our investigators. From an investigative standpoint, the number of cases that we have in the backlog status, the number of cases that we anticipate. So that's how we came up with that the 9 pens being allocated to intake and investigations will be enough for that piece.
Okay.
When we take a look at the number of inquiries and requests that we get from a training standpoint based off of our current staffing level, how many more would we need to satisfactorily be able to address the requests that we have coming in? And that's how we came up with the 3. The same thing with from a legal perspective, the number of attorneys that we would need to be able to efficiently respond to litigation trainings, things of that nature. So that's the assessment that we did, and really trying to make sure holistically that we were providing an environment where each department was getting some level of assistance to move forward. What we've done in the past is we've overloaded the investigator portion and forgot about the legal portion, right? So we were able to investigate more cases, but then those cases were backlogged in a bottleneck because they had to pause while we were waiting for an available attorney to be able to litigate those cases, right? So we're trying to make sure that holistically, as we're increasing in different areas, that we are also increasing in those other areas that are impacted by those areas, either indirectly or directly. So as we think about trying to figure out, as we increase our education outreach staff, we know that that's going to bring in more complaints to our agency. So there's going to be a need for the increased staff, obviously, in intake and investigations, and based off of the current backlog that we have. We also know about that by increasing in those areas, we also need to increase in our legal department because we're going to have more cases that we need to litigate. And if we don't have the resources to be able to do so, then folks' cases are going to be kind of sitting, waiting for an attorney to be able to address those cases. So we try to create the best scenario that allowed us all to be able to have some sort of remedy and relief as we all continue to increase in each department and be able to respond to those increases effectively.
Thank you. That's super helpful. I really appreciate that clarification. And then I'm just going to send you offline a couple of questions I'd love some answers on related to some of the items on Appendix 3, specifically about replacement of equipment, technical and special fees. So, and then travel and motor vehicle requests. So these are in the weeds, nitty gritty, but I'll send you a note and copy our analysts as well so that we can get some info. Delegate, Vice Chair Jones.
Thank you so much. I first want to start off by saying thank you. Thank you so much for the importance of your work, your commitment to it, especially in times that feel as though we're going very clearly in the wrong direction with a new lease that seems to be out there on things. So I too was trying to drill down on positions and understanding, because it felt like maybe there was different numbers here. I was going to ask about a breakdown, but as you can tell, we did a mind meld on that. A breakdown on salary and cost per pin, right? And then the understanding of investigator versus education, and of course the need for attorneys, which it sounds like it's very needed. I'm sorry if you addressed this as I was taking notes and maybe missed it. How long do you feel the backlog in a perfect case scenario will take time-wise to get through?
With the current resources or with the resources allocated in the governor's allowance?
Sure.
Which?
Sure, both.
All right, so with the current resources, we won't be able to. With the additional pens allocated in this governor's allowance, we should be able to get through the backlog, I would say, within about 12 months.
A year. Okay, good. And then are you seeing an uptick in the amount of calls, requests, and need for you all, let's just say, in the last couple months?
Absolutely. I would say that this started back in 2016, to be honest. In 2016, we saw a doubling of the cases that our agency was receiving, and it has not decreased since. Within the last 6 months, those calls have again escalated even more. Within the last 7 days, they've increased again, and then within the last 24 hours, they've increased again. So the community is directly responding to what they're seeing and their need for help. Folks are scared. Folks are trying to figure out where can they turn to for help, who do they go to if they need help. We know that there are significant targets on certain populations.
That's right.
And we want to be sure that we're able there to reassure them that we are here to protect their rights, but we also want to make sure that we're able to do that within a timely fashion.
Thank you so much. I know that I too am receiving a lot of calls from constituents who are scared and who are worried, especially from my LGBTQ+ community. So thank you so very much.
Thank you.
Chairwoman.
Thank you, Madam Vice Chair. Any further questions for the commission? Okay, thank you so much. Thank you. We look forward to our continued conversation, and thank you again to all of you for your important work.
Thank you.
There is somebody listed as unfavorable, providing unfavorable, Shaughnessy, DeBerry, Melvin. Are they here? Nope. Okay. So we have concluded now our budget hearing on the Maryland Commission on Civil Rights. So we are now turning to the Maryland Department of Health overview. As a reminder, we will have so many opportunities to see Madam Secretary and team this session in this subcommittee, and this is the first of many. So we will begin by asking Naomi Kimura, the DLS analyst for this budget, to please share some thoughts with us. Thank you. When you're ready. Okay. And the whole team is here. I love it. I love it.
Department of Health. All right, thank you, Chair Shetty. Again, my name is Naomi Kimura. I'm a budget analyst with DLS. I'm going to let Ann and Victoria introduce themselves as well.
Hi, my name's Ann Braun, Deputy Operating Budget Manager with DLS, and also here in my role as the Medicaid and the Health Regulatory Commission's analyst.
Hello, my name is Victoria Martinez, a Policy Analyst with the Department of Legislative Services, and I have DDA, the Office of Healthcare Quality, and the Health Professional Boards and Commissions.
Okay, so I'll get us started. So the entire Department of Health budget in fiscal 26 is $21.5 billion, which is a little over 1% decrease from fiscal 25. On pages, I'll just say page 4 starts a discussion on some of the actions related to the fiscal 25 budget in the fiscal 26 allowance. First, there's a couple of planned reversions to the fiscal 25 appropriation. There's about $2 million that will be reverted that was allocated for oversight of the Board of Nursing Operations, budgeted in the Office of the Secretary. There's also a planned reversion in the Behavioral Health Administration of about $26.5 million due to a surplus for fiscal 24 behavioral health Medicaid services. Pages 4 and 5 list some of the proposed deficiencies in fiscal 25. There's a comprehensive list of all of the proposed deficiencies in Appendix 1, so I'll just point out a few. The total results in a net increase of $2.25 billion to the fiscal 25 budget. A big driver of this is due to unanticipated spending growth in Medicaid and DDA. So there's $740.7 million of a deficit in DDA that's offset slightly by cost containment measures. And then there's also about $650 million to cover costs resulting from both traditional and behavioral health Medicaid services. All of these deficiencies are partially offset by withdrawals as well that are included in the fiscal 26 budget bill. Page 6 summarizes a few cost containment measures that the Board of Public Works took in July of 2024 to reduce the fiscal 25 appropriation. In the Department of Health, those totaled $26.1 million, the largest of which was a $12 million reduction in core public health services for local health departments. Page 7 shows a breakout of the total Department of Health fiscal 26 budget. As you can see, a majority of funding is dedicated to provider reimbursements. It represents about 86% of the budget in Medicaid, BHA, and DDA. There's also 4.3% of the budget allocated to personnel, which is split pretty evenly between the staff working at the state-run facilities and then in other parts of the Department of Health. Pages 8 through 10 summarize the major changes in the department between the fiscal 25 budget and the fiscal 26 budget. So the total budget decreases by about $290 million. This is driven by decreases in projected Medicaid enrollment and utilization, as well as a fiscal 25 deficiency in Medicaid. And some of these larger decreases are partially offset by increases in various areas, including provider rate increases under Medicaid. Okay, page 11 shows a list of contingent reductions in fiscal 26. These are reductions that are contingent on the passing of the BRFA. So I'll just call out a few up at the top. First is $92.5 million in general fund savings due to the increase of the hospital deficit assessment. There's also $90 million in special funds that would be reduced from the Consortium on Coordinated Community Supports, and $29 million in DDA that would be reduced contingent on a provision in the BRFA that would modify the provisions of the Self-Directed Services Program. I'll also note that there's additional reductions to DDA in fiscal 26 that are not contingent on the BRFA, and those equal approximately $417.8 million. Page 13 starts a discussion on personnel. So across the entire department, the fiscal 26 allowance includes 7,300 and about 7,391 regular positions and 349 contractual full-time equivalents. Exhibit 1 shows the change in the number of personnel between fiscal 25 and fiscal 26, separated by by agency, by unit. And so as you can see, there hasn't been much of a change between the 2 years. The department added about 700 new positions in fiscal 25. And Exhibit 2 on page 14 shows that growth. There's also an increase in vacancy rate during this period. So as of December 31st, 2024, the department had a 15% vacancy rate, again, across the entire department. And so DLS is asking MDH to comment on the status of filling some of these new positions that are contributing to that vacancy rate. Pages 15 through 17 include a discussion on some of the efforts that the department has taken to increase recruitment and improve retention at the department. Exhibit 3 shows the annual salary reviews that have been applied to various classifications in fiscal 23 and in fiscal 24. In general, the department indicated that these adjustments have yielded some positive results compared to fiscal 2022. Okay, that's it for personnel. So I'm going to turn it to Anne to talk about home and community-based waivers.
Great, so starting off the issue section, this first issue has to do with home and community-based service waiver programs. And those are programs that seek to help individuals live at home or in a community setting rather than in a nursing facility or state health facility. I'm going to focus on the ones that currently have a registry or a waiting list, and so that'll be community options and the model waiver under Medicaid. It includes the 3 DDA waivers and the autism waiver that is administered by MSDE. Exhibit 4 on page 19 shows the current statuses of those waiting lists and registries. They vary greatly in size. You can see that Community Options has a registry of over 20,000 individuals, while the waiting list for all the DDA waivers is less than 4,000 individuals as of the end of fiscal 24. They also showed slightly different trends. The Community Options waiver from fiscal 23 to 24 showed a 13% decrease, while that includes 3,214 individuals who were removed from the registry. The autism waiver decreased by about 15% from 23 to 24, as 1,000 individuals were removed. Although they are both decreasing in their registries, they do show different trends as enrollment in the autism waiver increased over that time, but enrollment in the community options waiver decreased. In fiscal 24, MDH didn't use all of its budgeted slots for the community options waiver, and so the reduction in this registry is more a sign of higher rates of individuals not returning applications and being removed from the registry rather than individuals being enrolled in the waivers and receiving services. MDH has described multiple reasons for not filling all of its community options slots. On page 20, there's a list of a few of these items, such as limited capacity of the provider network, ineffective methods for pulling people off the waiver registry, delays in eligibility determination and application processing, and low return rates of applications. Exhibit 5 on page 21 shows MDH's outreach efforts and results for community options application processing. On the left, you can see that MDH has increased its outreach. In fiscal 24, it sent just under 600 applications each month. And there was 2022 legislation that requires 600 applications to be sent out each month. As of December 2024, MDH has surpassed that and is now sending out 700 applications each month. Despite doing more outreach, the return rate is about 29% each month in fiscal 24. And then despite the low return rate of applications, MDH has not been able to process all of these applications coming in each month. You can see that about 84% of the returned applications are remaining pending in the month that they were sent. So MDH has indicated persistent staffing shortages as the main factor for application processing delays. For example, MDH reported a vacancy rate of 37% in fiscal 24 across positions that would handle application processing and eligibility determination for community options. To help out with this backlog, in June 24, MDH began using its contract for a utilization control agent to assist with some of the backlog in reviewing plans of service. So then page 22 begins a discussion on registry reduction plans. Those were required by the End the Wait Act, and in February 2023, MDH submitted 5-year plans to reduce the HCBS waiver registries by 50%. Through that, they estimated a wide range of potential state costs that varied depending on the waiver they were discussing. The Community Options Waiver Plan overestimated new fiscal 24 enrollment as part of the reduction plan, but has still seen decreases in its registry, as I described earlier. That's mostly due to the expanded outreach efforts and other efforts that MDH is taking to improve data sharing to remove deceased individuals and individuals who have moved out of state from the registry. MDH is asked to discuss an updated timeframe for reducing the Community Options Registry by 50%. The department's also asked to discuss the feasibility of transitioning from a registry to more of a wait list that would allow for more eligibility determination up front, and then other proposals to more efficiently enroll individuals in community options. Let's see. So one of the ongoing issues that MDH has described for reducing registries has been limited provider capacity and a shortage of direct support professionals. MDH described efforts to build capacity among the HCBS providers, such as rate increases, surveys on workforce challenges, and technical assistance. MDH has also described an effort to expand capacity specifically for individuals waiting for the model waiver, and that's by applying for a new waiver. So the model waiver is capped at 200 individuals, and so it does have a registry of about 180 individuals, and so MDH has proposed applying for a new waiver. It would also be capped at 200, but it would be there to help support that registry. And so MDH is asked to provide a status update on applying for and implementing that new waiver, including whether the fiscal 26 allowance provides any funding. To support End the Wait activities, there was $30 million added to the dedicated purpose account in fiscal 23. That was initially to support autism waiver expansion, but legislation then expanded it to be able to be used on the other HCBS waivers as well. Of that funding, $22.7 million has been spent or appropriated, and so approximately $7.3 million remains in the dedicated purpose account. Across fiscal 24 and 25, a total of $16 million was budgeted for End the Wait initiatives as well. Cost containment actions approved by BPW in July reduced $10 million of that funding, and the fiscal 26 budget plan proposes to transfer the remaining $6 million from the dedicated purpose account back to the general fund as part of further cost containment. And so that concludes that issue. I'm going to pass it back to Naomi for the second issue.
Okay, so I'm going to discuss the overdose crisis in Maryland. As everyone knows, this has been a big issue for a long time. According to the CDC, between fiscal 2015 and 2024, 22,406 individuals died from overdoses in Maryland, and almost 90% of these deaths had to do with opioids. Excuse me. Exhibit 6 shows the number of overdose fatalities both in Maryland and the United States. You can see that they have followed similar trends since fiscal 2015. And although that there was a decrease between 2023 and 2024 nationwide and in Maryland, the rates remain quite high. There's also pretty stark disparities across gender, race, ethnicity, and age and geography. Exhibit 7 on page 25 shows the rate of change in overdose fatality rates by gender and race and age between calendars 2022 and 2023. So the largest rate of increase in fatalities during this period was experienced among Black men over the age of 55. And then aggregating all ages, the largest net increase was experienced among Hispanic males. On page 26, Exhibit 8 shows the overdose fatality number, the number of overdose fatalities by jurisdiction, as well as the fatality rate. And then a little right to center on that chart, you can see Maryland's average. Baltimore City makes up the highest number of overdose fatalities compared to any jurisdiction in the state, and the highest fatality rate during this period, which is, pardon me, I didn't say, between December 2023 and November 2024. But there are 6 other jurisdictions that surpass the state average. Those tended to be, have much lower populations than Baltimore City. So on page 27 begins a discussion of the funding that's being invested to address this crisis. On page 28, Exhibit 9 shows the federal funding that the Department of Health receives through the Substance Abuse Mental Health Services Administration. Most of that funding is coming from the State Opioid Response Grant. The Department of Health is currently in the third iteration of the grant. It's a 2-year grant, and has already submitted an application for year 4 of that funding. There's also funding on this chart from the Substance Abuse Block Grant. Both of these grants are used to support prevention, treatment, and recovery. The State Opioid Response Grant is specifically for opioid abatement. Since fiscal 2022, the department has also received additional funding in COVID-19 stimulus from the COVID-19 stimulus legislation to enhance the substance abuse block grant funding. The bottom part of the page starts a discussion on some other types of funding that the Department of Health uses to address this issue. There's been quite a bit of money allocated in the Behavioral Health Administration budget in recent years for various behavioral health investments. So this can support an array of different programs, some of which are dedicated to overdose prevention and treatment. The fiscal 25 legislative appropriation included almost $90 million for these discretionary investments. And the fiscal 26 budget bill includes a fiscal 25 deficiency of $30 million for this purpose due to some delays in implementations of some of these programs. DLSC is asking MDH to comment on which programs and efforts were delayed, which result in the withdrawal of funds in fiscal 25. Next, I'll discuss the opioid settlements and the opioid restitution fund. So over the past several years, many states have received millions of dollars in settlement revenue resulting from litigation with the opioid manufacturers and distributors. That funding is based on various settlement agreements. That funding is directed both to the local jurisdictions themselves and to the states. So in Maryland, any money that's coming to the state is collected in the Opioid Restitution Fund. There's also an Opioid Restitution Fund Advisory Council, which meets regularly to make recommendations on how to spend the funding. At the close of fiscal 2024, the Opioid Restitution Fund had received $158.4 million in fiscal 23 and 24, and local jurisdictions had received $42.8 million directly from the settlement awards. Exhibit 10 on page 30 shows the funding that's been received in the state of Maryland since fiscal 2022, all the way up to projected funding that it expects to receive through fiscal 2038. This includes the money that's going, again, directly into the Opioid Restitution Fund, as well as the money that goes directly to subdivisions. The Opioid Restitution Fund's funds is mostly allocated as grants through block grants to local jurisdictions, as well as through competitive grant programs to local governments and to nonprofit organizations. There's a small amount of funding that has been used for data initiatives to collect and analyze data. And the Department of Health has also committed to expending any discretionary funding on grant funds to nonprofits and local governments. I'm going to turn it back to Anne to talk about Cigarette Restitution Fund.
Yes, so our final issue of the day is about the Cigarette Restitution Fund. That's the special fund for payments from tobacco manufacturers each year under the Master Settlement Agreement. Exhibit 11 on page 32 shows that CRF revenues across 3 years are showing a gradual decline of more than 8%. Revenues are expected to continue declining in the long run due to the consistent trend of less tobacco use in Maryland. If you turn to Exhibit 12 on page 33, you'll see that fiscal 24 CRF revenues were $25 million less than expected in that year. And in fiscal 25, the projected revenues are also expected to come in about $26 million less than budgeted. The biggest changes were due to lower inflation than expected, and then a larger negative adjustment for tobacco volume. So moving to a discussion on CRF spending, Exhibit 13 on page 34 outlines CRF uses from fiscal 24 to the allowance. To account for the shortfall in CRF revenues in fiscal 24, the amount for Medicaid was reduced by $25 million and then backfilled with general funds. There was also a small amount of underspending in other areas in that year. To cover the shortfall in fiscal 25, the budget plan proposes negative deficiencies that withdraw a total of $27 million in CRF funding for substance abuse services, breast and cervical cancer diagnosis and treatment services, and Medicaid, and the deficiency backfills that amount of funding with general funds. In fiscal 26, you can see that some of the CRF support for those programs is restored after being reduced in fiscal 25. The fiscal 26 allowance also includes 2 cost containment measures that are contingent on actions in the BRFA. The first would reduce $13 million from the statewide academic health centers at UMS and Johns Hopkins, and that's contingent on a BRFA provision eliminating the mandate for those grants. Since fiscal 25 provided slightly more than the mandated funding amount, the difference from fiscal 25 to 26 is showing a $15 million reduction. There's also $250,000 reduced in fiscal 26 for the Tri-County Council for Southern Maryland. That is money for the Southern Maryland Agricultural Development Commission. The BRFA includes provision that reduces the fiscal 26 mandate from $1 million to $750,000, and then it also phases the mandate out gradually through fiscal 28. CRF uses are restricted in statute, and one of the requirements is that 50% of budgeted spending supports certain programs and uses. A lot of them are health uses. Those are listed on page 33. Considering the contingent reductions, the fiscal 26 allowance actually funds those at about 43%. And so DLS is suggesting that MDH and the Department of Budget and Management propose a BRFA amendment to waive this requirement in fiscal 26 only so that it aligns with the budget. The next section discusses ongoing litigation between the state and participating tobacco manufacturers regarding the non-participating manufacturers adjustment. And so if participating manufacturers can prove that certain conditions were met, like showing a market share loss due to the Master Settlement Agreement, or that states were not diligently enforcing its statute, then the participating manufacturers might be able to see a reduction in their annual payments. Each year, an adjustment is made to put some of the MSA payments into escrow pending the results of this arbitration. And so in 2021, legislation required that any payments the state receives from this arbitration must be put into a separate CRF account, and those funds must replace general fund support for the HBCU settlement payments. For sales year 2005 through 2007, an arbitration panel decided in Maryland's favor that it did diligently enforce its statute, and so approximately $25 million is expected to be recovered by the state. The budget plan does not currently account for this funding, and so DLS recommends first adding a BRFA provision to allow the separate CRF account to support Medicaid expenses in fiscal 26 only, and then second would be to reduce $25 million in general funds from Medicaid in fiscal 26 in anticipation of these additional funds. These recommendations will appear in the Medicaid analysis, so you'll hear later in session. Starting on page 38, there are appendices providing additional budget and personnel data, but otherwise that concludes our presentation, and we'd be happy to answer any questions.
Thank you, DLS team. We really appreciate the thorough analysis. Do any members of the subcommittee have questions for DLS? Okay, thank you. With apologies for the delay, Madam Secretary, welcome for the first of many discussions in our subcommittee this year. Please feel free to bring up your team, and we're excited to hear from you. Secretary Laura Herrera-Scott, Secretary of the Maryland Department of Health. You may begin when you're ready.
Thank you, Madam Chair, members of the committee. As already shared, I'm Laura Herrera-Scott, Secretary of Health, and with me today at the table is Emily Brandenburg, our Chief Financial Officer. In the audience is also Dr. Ryan Moran, Deputy Secretary of Healthcare Financing and Medical Director, a Medicaid Director, and Alyssa Lord, Deputy Secretary of the Behavioral Health Administration. I've asked them here to answer questions at the end if we need them. I'd also like to thank our DLS analyst, Naomi Kimura, for her thoughtful analysis. This is our first budget hearing of many, and today is an overview of the agency. We know there will be subsequent budget hearings that will have more in-depth budget review for our different administrations. First and foremost, I would like to speak on how Governor Moore's fiscal year 2026 allowance represents substantial progress on critical healthcare services in light of tough fiscal constraints and federal uncertainty. The budget includes record state funding for Medicaid in FY 25 and 26, assuming more than 1.5 million Marylanders will have access to health care through Medicaid, including 700,000 children. With that, I'll jump right into our responses. Concerning the status of filling the 700 new merit positions, including in this year's budget, 116 positions have been filled, 391 positions are created but not yet filled, and 193 positions are in the process of being created. Creating and filling this many positions has been a big lift that involves coordination among multiple offices at MDH and DBM. We note that 1/4 of the 391 positions that are created are not yet filled and are tied to staffing at JLG Riker units that have recently been opened and new units at Finan that won't come online until next year. In other cases, we are holding new positions vacant in order to operate within budgeted turnover levels. We were also asked to provide an update on our projected time frame for reducing the community options waiver by 50% and estimated enrollment and slot expansions through fiscal year 2028. The department is working with Hilltop Institute to provide a more comprehensive answer concerning the projected time frame for reducing the registry by 50%. We will share this information to the committee once it is complete. The department has implemented several strategies to more effectively enroll individuals in the waiver and reduce the registry. Here are a few of the highlights. We increased the number of community option waiver program invitations, inviting registrants to apply from 300 to 700 mailed each month. We partnered with the Vital Statistics Administration and the Hilltop Institute to remove deceased individuals from the registry. We anticipate this process to be completed by March 31st this year. We have also partnered with the Department of Aging on screening processes to more accurately ensure those potentially eligible for the waiver are added to the registry. These actions, as well as others listed in our formal response document, have decreased the registry by nearly 1,500 registrants. We want to note that additional staffing resources would be needed in both eligibility services and long-term support services within Medicaid to support the transition of the registry to a wait list. Responding to the second problem, the FY 2026 allowance does not include a budget for the technology waiver, and as such, the department has not applied for the waiver. In response to the question concerning the behavioral health enhancements budget, the $30 million negative deficiency accounts for cancellation, delayed implementation, and rebudgeting decisions involving several initiatives. I'm not going to read through all of them, but they were impacted by, the items that were impacted by the negative deficiency, these were outlined in the written testimony. We are happy to answer questions about each of them. Elimination of initiatives enabled rebudgeting of behavioral health investment funds in FY26 and beyond to support a number of items that maximize federal funding attainment through Medicaid program. This includes the Behavioral Health Administration's BASO contract, or the Major Information Technology Development Program. As many of you know, that is the contract that's transitioning us from Optum to Carelon. The scaling of 1915I services, so those are services for children and families with severe emotional disturbance that will have an impact on our kids stuck in the EDs and potentially ED waiting times. Early and periodic screening and diagnosis and treatment rate increases for behavioral health, and implementation of mental health peer services in FQHCs. Lastly, concerning the CRF questions, MDH concurs with the amended BRFA language recommended by DLS. DBM will propose the requested amendment to the BRFA. In consultation with DBM, the department respectfully disagrees. While the arbitration panel estimates Maryland's awarded approximately $25 million, the final amount and timeline for receipt is uncertain until all participating states resolve their cases. Some states have yet to have a trial date set. The OAG's office shared a definitive timeline that could not be provided, but anticipated all states would likely be settled by FY 2027, at which point Maryland would receive those funds. You have our more detailed responses to all the questions, and with that, we thank you for your time and attention, and happy to answer any questions you have.
Thank you, Madam Secretary, for your thorough response and for this really important discussion that we're having today about the proposed budget. So thank you. Do any members of the subcommittee have questions for Madam Secretary? Delegate Heimbaugh.
Madam Chair, I'd also like to thank you. That was a very thorough response. That's like drinking from a water hose to listen to all that. So,
well, the details are in the written response, so I didn't want to read
I have and this may seem like a small point, but I have a personal interest. On page 3, it mentions that the FY26 budget plan fails to meet a requirement in statute that 50% of the CRF expenditures support specific programs and activities. And I'm just curious, did that happen because of a staffing shortage or an oversight or a funding issue? And then my second part of that question is, do you have a plan to comply with the statute?
It was an oversight as we look to swap some of the CRF funds with general funds, and DBM has agreed to put down amended language for the BRFA to correct that.
Okay. Thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, team. Delegate Ruff.
Thank you, Madam Chair. And Madam Secretary, thank you so much for your hard work. I had a question about page 10, the line item that shows the proposed cut of $13 million for cancer research funding. Would you agree that this cut would jeopardize the Cancer Center NCI comprehensive cancer designation for the 2 institutions in Maryland? And can you comment on why that funding was cut in the proposal?
So I can't speak to their revenue mix and what other funds it brings to the Cancer Center. What I can say is, as we've gone through the budget and tried to preserve the programs that we have, many of the programs are either paid for directly through Medicaid, as we think about direct services to Marylanders, which is mostly what the department does, either funds programs that do that. Much of that, those dollars do support research, which comes through other federal agencies such as NIH and other federal partners.
Okay. I guess I'll try and compartmentalize that and follow up with you on it. But I do also want to touch on the opioid crisis and the settlements. So I was really I was really taken aback by the stark disparity geographically in the state of overdose deaths from opioids in my city. And realizing that my city, Baltimore City, has twice the rate of any other city in the entire country of opioid deaths was really, really startling to me. But it shouldn't be startling because I grew up on a block that, a mile radius where I heard when I was a kid growing up that it was the largest concentration of heroin addicts in the world in Northwest Baltimore, in Park Heights. And although I understand that the city has opted out of the settlement, the pursuit of the settlements that the state has gone after, and I have to applaud my mayor and our city solicitor, Ebony Thompson, for their work. I'm wondering how the state is funneling additional funds on top of I think it was $668.5 million that our city has garnered, and I know the state has already garnered about $240 million and is expected to receive almost the same amount. How is the State Department funneling funds into Baltimore City to really address and to curb this stark disparity, not only geographically, but obviously also along racial lines, Black men over 55? That really concerns me, and I want to know how this budget, this moral document addresses that very pointed issue.
So I'm going to go a little bit upstream first. I don't think historically the department has done a good job in the way it's distributed its money. It's been a little bit more of what I refer to as a peanut butter approach, where everybody gets a little bit of money, and it's not necessarily consistent with the morbidity or mortality that's happening for that geographic area. Last year, we established, or in my first year in office, we established a chief data officer, and last year we rolled out our opioid data dashboard. I don't know if you've seen it, but we've made it statewide for people to have the data at their fingertips. So you can now sort at the zip code level to understand who's being impacted and by what drugs they're being impacted. And the reason why we did that is because, exactly to your point, we wanted to know exactly who are the communities, who are the populations being impacted by substance use. For instance, yes, there was a big increase in middle-aged Black men in overdose, but then surprisingly, women dying in the perinatal period postpartum is white women with a history of substance use. So we're trying to be as intentional as possible with the dollars that we do get to address the opioid crisis. Now, to your question, as far as the state settlement funds, there are some limitations on what we can fund since the city got almost $700 million. So we can't fund government agencies. I don't remember all the the settlement document, it has the terms, but we are continuing to fund community-based organizations and other not-for-profits in the city that address the opioid epidemic. The only thing that's different now, though, is we are using that data to be more intentional on where that money goes. I will say last year, probably about third quarter of calendar year, the money was under the state, under the Behavioral Health Administration, and it's still technically under the state, but now Maryland's overdose opioid response team is the one managing the settlement dollars. Okay. And they are getting ready to release their 2025 RFP.
Okay, so you're talking about the SSA that restricts the way those funds can be used. What about I guess it's Publicus fund, or the settlement for Publicus, which is on page 29. Is there a way to direct funds from that settlement, which I believe is to be used at the state's discretion, towards Baltimore City to be more pointed and to add more resources behind this very serious and very significant, crisis in Baltimore City?
Well, Well, so I just want to also say that the Behavioral Health Systems of Baltimore, which is the not-for-profit in Baltimore City that really directs a lot of money, they get about $50 million to support opioids, $50+ million. There's also dollars coming through the SOAR dollars, which is coming from SAMHSA, in addition to the settlement dollars. So the city is getting a lot of money right now. What we're trying to right-size is where in the city it's going. As I said, if you pull up the map, you can see very clearly which zip codes are impacted. And I don't know that those zip codes that are impacted are getting the percentage of dollars that they should be getting proportional to the epidemic in those zip codes. So that's one of the things that we're working on.
Well, you can start in 21215.
I know 21215 very well, and you'll also remember from years ago the life expectancy in 21215 compared to 21210, for example, or 21212 in Baltimore City is almost 20 years, and this issue is one of the reasons why it's lower. There are other issues, but that's certainly one of the issues. So I assure you, we have it on our radar and are working with the city to redirect funds. I just also want to say, when you redirect funds, it means you're taking funds from somewhere else to redirect those funds too. So we're trying to manage that as well.
Thank you, Madam Chair.
Thank you, Delegate. Thank you, Madam Secretary. Vice Chair Jones.
Thank you so much, Chairwoman. And thank you so much, Secretary, and your entire team. Need to acknowledge it's been a 27-hour day.
Hence the hair in a ponytail today.
Well, you cannot tell. Your team is here. They are just so wonderful to work with. But, you know, it has been a roller coaster, unnecessarily, as always. And so I'd like to address some of this. Now, as of, you know, you were already sitting here at 12:58. Breaking news says that the White House now rescinds a freeze on federal grants in a reversal of M-25-13. But we'll see what happens at 5 o'clock. We'll see what happens tomorrow.
Their press secretary already has come out with a different statement.
Sure. And to that point, my point is that we still need to kind of drill down on how we're going to proceed, right? Because so given that federal funding, and the freeze, that it could come back, that what they will do, even by week's end with the Trump administration, can the department provide an update on what you know we would do? Like specifically, can you share the impact on Medicaid enrollment and grant recipients who receive funding through the SAMHSA? And if they do go back, if they are going backwards on the rescinding it, they keep going back and forth.
So I don't know the answer to that. Okay. Yesterday was one of probably the scariest days that we've dealt with in at least my time as leader. As you can imagine, there was a lot of chaos and panic. So not only in us trying to do our jobs to get money out to providers, but in providers calling in, and even those agencies that have the ability to go into the system to draw down those funds directly themselves, not being able to draw down those funds. So I don't have a clear answer for you. We are, and we have been doing contingency planning, but even all our contingency plans don't account for the suddenness of what we experienced yesterday, and then financially, because of the short duration, how we would move things around. So we are actively looking at that, but I don't have a more definitive answer or plan for you today.
Today, right. But I do hear that you are looking at and preparing contingency plans.
We have been preparing, but again, because of the suddenness, I don't even know that we were prepared for that. So.
Sure. Well, as my grandmother would say, God love you.
Well,
God love you. On page 28 now, Exhibit 9, FY26 shows that there is roughly $141 million of federal funds that are included in the FY26 for substance abuse, right? So what do we expect to happen with that funding with the current political climate? Is it part of that contingency plan? Should we
Yes, because if you look at the purple block and the SOAR grant, those are all SAMHSA dollars.
Yeah.
Coming from HHS.
Thank you so much.
Thank you, Madam Vice Chair. Thank you, Madam Secretary. Delegate McCaskill.
Okay, thank you, Madam Chair. I just almost don't even know where to begin. Okay, I was looking at page 6, and you all made me do some research, and thank you, Joe, because I was curious of what the value-based purchasing pilot program is. And then I got a correspondence from 2023 kind of explaining it, but I still would like a little clarification of what it is. And then I noticed in this correspondence from the Senate Finance Committee that other states had issues as well with implementation of this. And I'm noticing that one of the cost containments is the $600,000 for this program. It was reported not launching for fiscal 2025. So I'm wondering, one, if you can give me a little explanation of what it is, and then two, are you all finding, where are we with the launching of it, or are you finding some of the same issues that other states have had?
So I'll just talk about value-based programs in general.
Okay.
And so value-based programs are generally incentive payment programs for specific outcomes. So for example, in Maryland Primary Care Program, that's a value-based program. Okay. And we give clinicians enhanced payments to do certain things. And that could be to improve health outcomes related to diabetes and hypertension, blood pressure control, 140 less than 90. Okay. To improve screening rates for colorectal cancer and breast cancer, or to include immunizations for adults, as an example. Okay. So the value-based purchasing pilot in behavioral health was the same kind of program. How do you create payment incentives for behavioral health providers to manage care better? So that could be, I was just in the hospital with acute psychosis or substance use, and I need follow-up from the ER within 7 days, as an example. So that's what that program was about. We are not going to be launching it at this point because of the fiscal constraints, and we hadn't launched it because of just getting the program live, but because of the fiscal constraints, we are pausing the deployment of that program.
Okay, perfect. All right. Now I'll go to, I guess I'll go to page 15 first, Madam Chair, if I may. Thank you. So page 15, it discusses the recruitment and retention efforts. And so I just want to understand a little bit more about the plans for personnel within the state psychiatric hospital. Specifically, are there any plans around the ASRs for FY26 for the employees of these facilities?
So we don't have any ASRs right now for 2026, okay. But we have active recruiting happening, especially at Perkins right now. I think you all have read about some of the issues at the Perkins facility. And so we have a new HR director for MDH, and she has built a core team on around helping to staff up Perkins. We've had on-site job fairs where we were made offers real time. We've had participated in other job fairs, having a table to try and recruit for MDH. So we are actively recruiting for Perkins. Something else we're doing a little bit differently, especially for senior leadership, is having them do their final interviews in Perkins, so they understand what a maximum security forensic facility is like versus working in a hospital, for example. So we are trying to fill those positions as fast as we can.
Perfect. And lastly, Madam Chair, thank you. I'm referring to page, I folded it down, 2020 and page 2021. It seems, and I'm referring to the community option waivers. Okay, perfect. It seems like there's been, of course, a continuous issue with it. And so specifically, the analysts mentioned that there are, and I'm going to quote, outdated and ineffective methods for pulling people off the waiver registry. Is the department leveraging data available, come on up, via MD Think? MD Think, we just figuring out how we can utilize what we have, or perhaps you've already thought about this.
Yes, absolutely. So first I want to say it's a multi-pronged effort. The registry over the course of the last decade has obviously been building to where you find it right now. Obviously, we've seen some reductions in it since the past 2024. Let me talk about some of the strategies. The first is we have instituted an algorithm that's in place that first and foremost pulls people that are at a higher level of institutionalization and prioritizes them to apply for the waiver. That is a process that we work on with Hilltop. That's a system automation that we have. Secondly, we've noted that per legislation in the wait, we are up to 700 per month of individuals that we're inviting to apply to the waiver, which we have seen a reduction of individuals on the registry, if you will, from that particular work. The Maryland Access Point sites, which are local area agencies, which help direct seniors to resources, including the community options waiver, with the Maryland Department of Aging, talking about antiquated processes. They were in the process to say, okay, this individual needs particular resources, you potentially might be eligible for the waiver. They weren't doing any particular screening that determined whether a person would actually be eligible, even if they were put on the registry. So we're partnering very closely with Secretary Rokes to ensure that we've got a screener in place so that really people who actually need the registry are really on the registry, and we're just not adding people for uncertain reasons as well. So there's a multi-factor plan in place. We're increasing staffing related to our eligibility determination division. I just was talking to the secretary earlier to this. We've are signing off on about 10 appointments to that particular division, creating a waiver training services division. Obviously, I could go on and on about the particular work because it's been such a big focus of our time to try to get our arms around the issue.
Okay, perfect, thank you. I think I may need a minute to digest that.
No problem.
And I may have some follow-up, but thank you.
Happy to do
Madam Chair.
He'll be back for the Medicaid budget.
Okay.
Thank you for that assurance. Thank you, Delegate. Okay, so I have just a couple of questions. All of them will probably reference different sections of the DLS analysis. So first is related to the Center for Firearm Prevention and Intervention. Really excited that MDH has launched this last year. I see that you all have requested $1 million for the center. I can't tell in the section of page 9 whether it is a change over last fiscal year, like an additional, or if it's $1 million total.
Okay.
We have moved it from public health to office of the secretary.
You've moved it.
Right.
Okay.
So that's the $1 million that you're seeing move
I
from
see.
public health to office of the secretary on page 9.
Okay, thank you. That's super helpful. And can you please comment on what the planned use is for these funds?
So we've hired the executive director who started actually just a few weeks ago. She comes to us by way of Hopkins and is a national thought leader in this space. So we're very excited that she joined. We've hired a data analyst and we're getting ready to release our Center for Gun Violence dashboard, which will be very similar to what I just described with the overdose dashboard, which is searchable by zip code, by gun type, rifle, handgun, and suicide and homicide. And the reason why that's important, because in parts of the state like Baltimore City, homicide are a big driver of gun violence, but in the Eastern Shore and Western Maryland, suicide is. And so the interventions that we're thinking about are very different. We plan on funding a bunch of different things now that we have so a data analyst, the executive director, and a program manager. And then we plan on funding a few different things with the dollars, and those RFPs should be out within the next month or so. On violence reduction councils, so how can we work with those communities hardest hit to address the violence in their jurisdiction? We are focusing on Prince George's County due to their high rate of gun violence and their close proximity to DC. Because of the data dashboard that we've put together, we're seeing trends that are very different than what we see in the rest of state, which is Baltimore City, but we're doing work in Baltimore City as well. Safe storage, supplies, and education. So the behavioral health team, when the local behavioral health authorities, when they go out and do, like for domestic violence calls, they are leaving gun locks behind. So we'll be doing more expansion of that. More work on community violence intervention, as well as youth violence program expansion. And for the youth violence program expansion, we are working with DJS on that one. And then community engagement. We have a lot of community partners that are doing great work. And so how do we take their work to scale? So I can go into the amounts, but we were going to do that in our Office of the Secretary budget, but it's moving.
Okay, got it. Thank you. That's super helpful. Can you please, so I'm going to sort of switch gears here and talk about the Blueprint Consortium dollars. So the budget proposes $90 million of cuts to the Blueprint Consortium, which, as we all know, supports a lot of important mental health and wraparound services for young people in schools. And so I'm wondering if you can share whether the funding for the consortium had already been committed.
So I actually don't know the question to that. So the consortium is technically an independent agency that MDH is more of the pass-through for related to HR and some of their processes. So I think there is budget hearings for the boards and commissions, and that question would be best asked to Mark Luckner.
Okay, great. We will hold the question till then. Thank you. All right, and then the last question I have is on planned reversion. So on page 4, which discusses planned reversions, can you please talk to us about why MDH is reverting $1.9 million to the general fund for oversight of the Board of Nursing?
So as you know, last year or 2 years ago, the Board of Nursing was moved onto the department. And so with we had, was that related to the MITDP or 1.9? Yeah, I'm going to.
It's related to, we have infrastructure control, operation control currently under the Office of the Secretary under MDH administration. And it's sunsetting, and so this is potentially a planned reversion depending on when the new funds get implemented and released. There potentially is about $1.9 million that we'll be able to return or revert back. It's a moving target, but it's what we're estimating at this point in time.
Great, thank you. That's super helpful. I appreciate that. That's all my questions. Delegate Ruff, I see you are in for some more.
Thanks. Just briefly. Thank you, Madam Chair. I've been trying to track the transition between from Optum to Carillon, and I'm wondering how that's going. Are you finding that there's disruption to the behavioral health providers, and if so, how is that addressed in the budget proposal?
So the Optum transition, Optum to Carillon transition, we flipped over January 1st. Myself, Deputy Secretary Moran, and Deputy Secretary Lord have been leading the way in that transition. They're paying claims, so the system is doing what it's supposed to be doing. But there have been some pain points related to configuration issues on the provider side and on the Carillon side. I think you all remember Optum never fully achieved the contract expectations under the prior agreement. And so the files that we got over, that we had to base the new system configuration on, were not complete. And so we're identifying some issues as we go live in troubleshooting. We do have some providers that are having some payment issues, and that's a few ways related to work the providers were supposed to do to get their new provider ID in the Carelon system, and they weren't as proactive as they could have been. It's kind of like as a primary care provider, you know, the patients that call you on the day they need their refill and you haven't seen them, and so you want to do another exam because you haven't seen them, but they need their refill. So the providers did not get their provider IDs in time, and so Carelon is working with those providers to get them into the system. In the meantime, we've relaxed authorizations so that the claims will pay. They still have to load up their authorizations, but for the month of January, that wasn't the thing to hold up the payment. The other thing is they also, under the Carelon system, had to apply for electronic funds transfer. So the same way you do when you get a new job, to go right into your bank account. So the first week, as part of the process, we had to issue paper checks. But then, as you recall, there were some holidays that really impacted those paper checks going out. So that sounded like a scream, didn't it? Okay. So there were some delays in payment. This week's check run was about 83% of what it used to be under Optum. So it's getting better, and you know, we're almost a month into the first rollout of Carelon. So it's good. It's been a little bit bumpy. The call center has unfortunately long wait times with abandonment rate, but again, we meet with Carelon every single day now to address the issues that we're hearing from providers.
Thank you. Thank you, Madam Chair.
Thank you, Delegate. Thank you, Madam Secretary. Delegate Heinbach.
Thank you, Madam Chair. Just a quick question. I think I know the answer to this, but I'm going to ask anyway. A lot of people in my district, which is Garrett and Allegheny County, are dependent on Medicaid. I'm just curious, if there's a reduction in federal funding for Medicaid, do you have any flexibility in terms of prioritizing how the money is spent, or where it's spent, or is it coming like pots and you don't have any flexibility with it?
Yeah, so I think, let me just answer your question in terms of some of the contingency planning back to the Vice Chair. So there are a lot, I think what you're referring to, there are a lot of particular proposals that are on the table currently at the federal level that would change the mechanisms of how Medicaid financing works. Just highlighting a couple of those, right? Right now, we're in Affordable Care Act expansion where all adults up to 138% of the federal poverty level are covered. It's about 400,000 Marylanders. One of the proposals, as an example, is we receive a 90% federal match to pay for those individuals. The state only puts up 10% of that particular match. So one of the proposals is to say, why is that match so high from the federal government? Could we potentially move those particular matches down to 50%? Where we will work in terms of our particular discernment on those proposals is really thinking about the financing from the state available funds that are available, if any of those particular things change. We have our eye on all of those particular proposals. We've modeled out almost every single scenario that we know of about what the potential fiscal impact would be. I know our colleagues from the Department of Legislative Services provide an appropriations briefing about some of those things, but right now it's a matter of getting concrete examples that will specifically be floated at the federal level rather than just ideas, which is all we have at the moment.
All right. Thank you. Thank you, Madam Chair.
That's a really great question, Delegate. Thank you for asking it, and thank you, Deputy Secretary, for answering. Any further questions from members? Okay, thank you so much. We look forward to our continued conversation this year. And that concludes our final budget that we're reviewing this afternoon of MDH Overview. Thank you so much, everyone. We will see you tomorrow in this room for our next set. Take care.